Hello, my name is Caitlin Henry, and this is for the course PHS 356 or Foundations of Policy Law and Ethics. And for my micro lecture, I chose to do a review on the 2012 film The Waiting Room, which is directed by Peter Nix. And this documentary is actually very interesting as it showcases real life stories of patients and healthcare providers in a public hospital in Oakland, California. And so my goal is to use this film to discuss these challenges and struggles and see how they can be used and applied to this course as well as healthcare field in general. Well, here's just an overview of what I will be talking about in my micro lecture. Specifically, I will be discussing a summary of the film The Waiting Room and just kind of using intimate and real world experiences to kind of summarize what the main points of the film are about. I would also like to talk about how the film relates to healthcare policy law and ethics. Specifically, I would like to talk about the Emergency Medical Treatment and Labor Act, or EMTALA, which requires hospitals to treat all patients equally, regardless of their ability to pay, which I feel like helps us to just understand the film's portrayal of the United States healthcare system. Um, by really examining those real world experiences, it really impacts how EMTALA is applied. Additionally, I would like to talk about how themes from the film can be related to the course, specifically equality, patient rights, and systematic challenges that many public hospitals have to face, and just use those real world experiences to relate to a broader course concepts of policy healthcare. And then finally, I will discuss the sources that I used and just kind of summarize and close my presentation. I just would like to use the presentation to deepen the understanding of policies that are really showcased in the film and just encourage thoughtful discussion on each policy and just talk about the future of the healthcare system. This slide is a summary of the film The Waiting Room, which is a documentary that is very intimate and very emotional with personal stories of patients and healthcare workers who are really struggling in a public hospital. It really explores the challenges of accessing healthcare, such as long wait times. And it just really shows both sides of the story how somebody is waiting for hours to access healthcare, while on the other end, these healthcare workers are very understaffed and have no rooms to put any more people. And so the film just really showcases the complexities of the healthcare system, and particularly, it really shows disparities among individuals who are uninsured or underinsured. And it's really hard to watch them know that they need healthcare access, but they can't afford it. And so the hospital can't turn them away because of EMTALA, but it's really hard to watch the ethics behind the stories. And so, while they're documenting healthcare workers and their behind the scenes struggles of being overstaffed and overpopulated, it's just very difficult for everyone in the healthcare world. And just seeing the struggles behind everything and just the circumstances that many people face. So, through this real time footage and these candid conversations, we're really able to look at an overview of a public health care hospital, but specifically, you can really use it to examine several hospitals in the United States and just look at how our healthcare system is impacting people in these cities who are just wanting to go to the hospital, but they can't, with very extreme wait times, and insurance is a big issue for a lot of these people. Well, on this slide, we're going to discuss EMTALA, and although it wasn't specifically discussed in the film, you can definitely see the themes of EMTALA applied in the public hospital. And although EMTALA, or the Emergency Medical Treatment and Labor Act, was enacted as a positive route for hospitals and emergency rooms as it prevents patient dumping and requires that hospitals treat every patient regardless of their insurance status or their ability to pay. And so it really is a positive attribute of the healthcare system as it really creates an equal treatment despite financial disparities. However, many patients without non emergent conditions tend to overcrowd hospitals because they're not going to doctor offices, they're going to the hospital. So, this definitely creates several hours of waiting times because many of these patients are coming to the hospital, and it can create limited resources and understaffing issues. So, for example, in the film, there was a patient who showed up in the ER with a non life threatening condition. It was a very minor issue, but because of EMTALA, the hospital cannot just turn them away. And so, this is a real life illustration of how EMTALA is used and functions in the hospital. So, while the law really does ensure that no one is denied care when it's needed, it is also contributing to systematic inefficiencies and kind of overburdened emergency care. The film The Waiting Room can really be used as a resource to healthcare policy law and ethics, as it really offers real world perspectives on these policy laws and ethics by giving us firsthand accounts of what's going on in these hospitals. So we're really able to look at patients and healthcare workers in these overcrowded public hospitals and use them as a valuable resource for exploring these complex healthcare issues. Many include access to care, the application of other policies similar to EMTALA, and really just factors that influence health outcomes. So, for example, in the film, a nurse was discussing how they feel caught between doing what is the right thing for the patient but also doing what is possible given the time restraints, the available of staff, and the availability of resources. So this really highlights the ethical stress of healthcare workers and their professionalism in overfunded and overburdened hospitals. And so the experiences of this film can just really serve as a valuable starting point to talking about these social and healthcare issues, and we can really talk about access to care, patient rights, the ethical dilemmas of patients and hospital workers, and just the difficulties of vulnerable populations. So, as somebody who is seeking a job in the healthcare field, it's very important for me to be aware of several of these issues so that I can try and make a positive change when I enter into them. So, it's just very good to have a mindset that is willing to work through these issues and just working with other people around you to help solve these healthcare burdens that many people are having to face right now. So this slide is where I conclude my presentation, and I just want to say thank you for listening to my review on the waiting room, and I just really hope that we can use resources like this to be aware of healthcare challenges and disparities, and just know that as we enter into the healthcare field, these are challenges that we're going to have to deal with as well. And so we need to use this course and resources and apply them to how we can be thoughtful and um, how we can move forward with a positive mindset going into the healthcare world and willing to make a change.